Hi everyone, welcome back to my channel. Let's see the topic about thrombosis. Thrombosis. First, definition of thrombosis. Thrombosis is the formation of a solid mass formation of a solid mass blood clot from the constituents of blood. Constituents of blood such as platelets, fibrin. Next one is entrapped red cells. Entrapped red cells and white cells. Entrapped red cells and white cells. Within the heart, or vascular system in a living organism. Vascular system in a living organism. The development of the clot, is life-saving. When a large vessel ruptures or is severed. Next point, however, when a thrombus develops, within the vascular system, it may be life-threatening. Thrombosis is the consequence of inappropriate activation. Thrombosis is the consequence of inappropriate activation pathological of the processes of normal hemostasis. First, thrombosis is the formation of a solid mass blood clot from the constituents of blood such as platelets, fibrin, entrapped red cells and white cells. Then within the heart or vascular system in a living organism, thrombosis can happen. The development of a clot in is life-saving when large vessel ruptures or is severed. However, when a thrombus develops within the vascular system, it may be life-threatening. If the thrombosis occurs in the vascular system, the patient will die. That's the main thing. It may be life-threatening. Thrombosis is the consequence of inappropriate activation of processes of normal hemostasis. Then about normal hemostasis. Normal hemostasis. First one, arteriolar vasoconstriction. Arteriolar vasoconstriction. Arteriolar vasoconstriction. Second one, primary hemostasis. Primary hemostasis, temporary platelet plug. Temporary platelet plug. Temporary platelet plug. In primary hemostasis, there is platelet adhesion. Platelet adhesion. Next one is platelet activation. Platelet activation. And next one is C is platelet aggregation. Platelet aggregation. Then third one, secondary hemostasis. Solid permanent plug. Solid permanent plug. Solid permanent plug. In secondary hemostasis, there is activation of coagulation cascade. Activation of coagulation cascade. Activation of coagulation cascade. Next one B. Conversion of fibrinogen to insoluble fibrin. Conversion of fibrinogen to insoluble fibrin. Next C. Aggregates of polymerized fibrin. Aggregates of polymerized fibrin and platelets. Next, the fourth one, counter-regulatory mechanism. Counter-regulatory mechanism. Counter-regulatory mechanisms. Restrict plug to site of injury. Then about factors, the main factor, thrombosis is influenced by three major factors. Thrombosis influenced by three major factors. Thrombosis influenced by three major factors. The main triad is Virchow's triad. Virchow's triad. In Virchow's triad, here thrombosis, endothelial injury, abnormal blood flow, hypercoagulability, hypercoagulability, thrombosis, endothelial injury, abnormal blood flow, hypercoagulability. Abnormal blood flow to hypercoagulability, endothelial injury. Okay, this is Witchow's triad. Witchow's triad. First one, injury to vascular endothelium. And the second one is abnormal blood flow. Abnormal blood flow. And the third one is hypercoagulability. 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 These are the three major factors: injury to vascular endothelium, normal blood flow, hypercoagulability. First one, injury to vascular endothelium, endothelial injury. Endothelial injury. First one, endothelial injury. It plays a major role in the formation of thrombi in arteries. Plays a major role in the formation of thrombi in arteries. In endothelial injury, once the endothelium is damaged, subendothelial collagen may be exposed from the tissues and the tissue thromboplastin is released, and the sequence of platelet occurrence and activation of clotting factor sequences. Here, in endothelial injury occurs, endothelial injury occurs in myocardial infarction. The next one is ulcerated atherosclerosis. And the third one is trauma and inflammatory diseases of vessel. Inflammatory diseases of vessel. Diseases of vessels. The next one is endothelial dysfunction. Endothelial dysfunction is also a predisposing factor. Is also a predisposing factor for thrombosis. Then, example, hypertension, and the second one is bacterial endotoxins. And third one is radiation, cigarette smoking, cigarette smoking, hypercholesteremia. These are the main examples of endothelial injury. Then the second one, abnormal blood flow, abnormal blood flow, abnormal blood flow. First point, bringing platelet close to the endothelium, bringing platelets close to the endothelium. Second one, accumulation of clotting factor, accumulation of clotting factor, accumulation of clotting factors. Third one, prevent clotting factor inhibitor, prevent clotting factor inhibitor. Next fourth one is endothelial activation, endothelial activation. These are the main things, bringing platelets close to the endothelium, accumulation of clotting factors, prevent clotting factor inhibitors, endothelial activation. Then about examples, MI, myocardial infarction. Second one is aortic aneurysm. MI, aortic aneurysm, valve stenosis, valve stenosis, hyperviscosity, sickle cell disease, sickle cell disease, RHD, rheumatic heart disease, rheumatic heart disease. The next one, third one, about hypercoagulability. It is alteration in coagulation leading to thrombosis. Alteration in coagulation leading to thrombosis. Leading to thrombosis. Alteration coagulation leading to thrombosis. In hypercoagulability, there are two factors, primary and secondary. Not factors, just primary and secondary. Primary is genetic and secondary is acquired. Primary is genetic and secondary is acquired. In primary, first one, primary, factor V mutation, prothrombin mutation, antithrombin 3 deficiency, antithrombin 3 deficiency, protein C or S deficiency. These are the major primary genetic. Then next about secondary, acquired. In secondary acute, high risk for thrombosis and low risk for thrombosis. Next one is low risk for thrombosis. High risk for thrombosis, low risk for thrombosis. High risk for thrombosis, low risk for thrombosis. High risk for thrombosis, myocardial infarction, MI, prolonged immunization, tissue damage, cancer, prosthetic cardiac valve, lupus anticoagulant. Low risk of thrombosis, cardiomyopathy, sickle cell anemia, next one is nephrotic syndrome, next one is contraceptive pills, next one is smoking. These are the major low risk for thrombosis. Thank you guys.